Well, hello, everybody. Welcome to our Kaweah Delta ambassador groups, all of our advisory committees and community members. Thank you for joining us today. It's Thursday, August 27th, and this is our 25th weekly virtual community meeting. So Gary, happy 25th anniversary. I think this is the silver anniversary, so we should have brought cake, but as many of you can see, I'm not in the room with Gary today. We are actually virtual as well, so it's going to be something different for us, and we're going to do our best to make sure that this is a very engaging meeting. So I want to take just a minute and thank all of you for joining us, and those of you who continue to log on every week. We are so thankful for your engagement. I want to thank Gary publicly for the amount of time and effort he puts into all of these meetings. You know, sometimes you ask us questions that we have to research and make sure that we are 100% correct in our answers. So Gary, thank you for taking the time to join us. And I really just want to remind all of you guys that these are meetings just to keep you updated on what is happening at the hospital. These are not intended to stir any kind of political pots or encourage policing in any way. You know, Gary cannot he can give you his opinion on whether or not the schools and the churches should open, but the hospital is really not in a position to get involved in any of those decisions. Just like you, Gary and I are community members, and we are personally affected by everything that happens for our community. And we are as excited for things to get back to normal as possible, but our new normal, who knows what that's going to look like. So what we're going to do right now is we're going to dive into the questions. As with every week, you can chat us, you can email me, you can text me, and we add those questions into the discussion. Then this is put on our COVID-19 Kaweah Delta page, and we cut up the questions and answers, and sometimes they're used on social media. So thank you again for joining us. Gary, it's good to see you virtually. And you're looking good today, and I hope your day is going well so far.
All right. Yeah, thank you, Deb. This is a little different. I am accustomed to having you 6 feet apart, but physically in the room with me here. So we'll kind of fumble our way through this a bit. So maybe I'll give you some type of signal when I'm done answering a particular question. So. Yeah, but
hey Gary, I do want to say for those of you who are probably going to start texting me right now saying, why aren't you in the room with Gary? You know, are you okay? And I did have surgery on Friday, so if anybody wants to know about whether it's safe to come to Kaweah Delta and have surgery, feel free to ask me any questions that you have on that. But I'm feeling good and I'm back to work, but just approved to work from home.
That's great. Well, you look great. So glad to see that your surgical outcome was really positive, and it sounds like you had a good experience. So
I really did, Gary. So
right.
Thank you.
Well, take care of yourself, and we look forward to having you back here in person, Deb. So yeah. So thank you for having me back. I did have a couple days off last week. I think I mentioned the week before that my family joined me down in the little town of Summerlin, just slightly south of Santa Barbara, to finally celebrate my 60th birthday, which happened back in April. But we finally got a chance to get away, and so it was fun. But good to be back with you. The first thing I always like to kind of lead off with is just giving you an up-to-date sense of where we are relative to all the numbers, the statistics at the state level, the county level, and here locally at Kaweah Delta. It is a very fluid process, and sometimes the numbers I'm giving you might be as of yesterday, possibly like with a 7-day rolling or 14-day rolling positivity rate, that might be lagging a bit, but they're really pretty much reflective of what we're actually seeing right now. So at the state level, the state of California now, as of yesterday, has performed 10.8 million COVID tests. Most likely all on California residents, but it's possible we had some travelers from other states. So of the 10.8 million tests that have been performed, 679,000 of those tests were positive for COVID-19. which represents then a positivity rate over the entire duration of the pandemic of 6.3%. The state is reporting that its 7-day positivity rate, so just the number of tests and those that are positive over the last 7 days, is actually dropped down to 5.8%, so lower than it has been over the entire duration of the pandemic. And if you look back over the last 14 days, it's at 6.1%, which basically means that over the last 7 days that the positivity rate has been declining, so that the 14-day rate of 6.1 is now dropped down to 5.8. So that's a good thing. Positivity rate means a lot to us, and we'll talk further about that in a moment. Unfortunately, there have been, of those 679,000 positive cases, there have been 12,407 total deaths, which represents a rate of 1.8%. So of those that have tested positive in California, 1.8% of them passed away from the virus. Right now, there are 34 of the 58 counties throughout the state of California that are on the state's watch list, which essentially what we share in common then among those 34 counties is that we are more shut down from a business and societal standpoint, not allowed to have in-room dining. Our gymnasiums are closed. A number of other businesses not allowed to open yet. And we'll talk about, I know one of the questions is like, well, how do we get below that 8% positivity target that the state is looking for before you come off that watch list? Of those 679,000 positive cases, just a real quick age distribution again, 10% of them are under 17 years old. 60% of them are between 18 and 49 years old. So I realize that's a big age bracket, but that's where the majority of the positive cases are falling in. 19% of them age 50 to 64, and just 11% of the positive cases that are over 65 years. Currently hospitalized, there are 4,365 positive COVID patients that are in a hospital somewhere in California, and roughly a third, 31% of them are in the intensive care unit. In terms of healthcare workers, who obviously are far from immune, in fact, they're really on the front lines, but they also practice some of the most vigilant precautions and donning all the personal protective equipment. So we've had just under 31,000 of the 679,000 positive cases in California that are healthcare workers, and sadly 146 have died over the duration of the pandemic. So that's where we are at the state level. If we drop down to more local, the county, and just reminding folks that we have just under about 500,000 people that live in Tulare County. The county has now performed 120,000 COVID-19 tests. So 10.8 million at the state level, 120,000 at the county level. And I believe those are individual people. So not, in fact, I know that they're not counting multiple positive tests. But if we do multiple negative tests, generally those are counted as a separate test. So, roughly 25% of our population has had a COVID-19 test. Of the 120,000 that have been tested, just under 14,000 have tested positive. That would mean that our cumulative positivity rate over the duration of the pandemic is at 11.4%, obviously much higher than the state's 6.3%. And folks ask, why is that? Well, the CDC initially was really recommending that hospitals, healthcare workers only, tested, and even county health departments, that they only really test symptomatic patients. And so if you're only testing symptomatic patients, you are going to have a higher positivity rate versus we test anybody that wants to be tested. And frankly, I think that's what we see at the state level is literally anybody can get tested. It really depends on the availability of specimen collection sites and the testing capability in different areas of the state. So I think that's one reason why there's a different positivity rate from one area, a county in particular like us, versus the state. But again, we'll talk more about that. The 7-day positivity rate for Tulare County, unfortunately, does kind of remain high at 12.6%. This was as of August 19th. And again, I think the preponderance of the testing that we're doing in Tulare County are on symptomatic patients. In fact, at Kaweah Delta, the only asymptomatic patients that we test are those that are going to have elective surgery here. And we've continued to keep that kind of down as we purposely try to preserve staff and PPE and keep beds available. So again, Kaweah Delta is also going to have a higher positivity rate as well. So the county's 7-day at 12.6, but their 14-day at 14.3%. So just like the state, the county of Tulare has also seen that positivity rate dropping over this last week. So that's a good sign. Tulare County's had 224 deaths over the pandemic. About half of them, 113, related to nursing home residents. So the state rate of death, again, the percentage of those that test positive but succumb to the virus is at 1.8%. Tulare County is at 1.6%. So 224 deaths on almost 14,000 in positive cases. And then lastly, and very positively speaking, that 93% of all those positive cases in Tulare County have recovered. And I have to be careful to not use the term fully recovered, because we do read a lot about that while people may survive the virus and be considered recovered, that a lot of times that journey is not over yet, that there are lasting effects of having the virus. And we read about that, a continued loss of taste or smell, some suffering, cardiac ailments, continuing to require oxygen to help them breathe. So recovered is, I just have to be careful, that how I use that term. But there are 459 residents of Tulare County that again have tested positive, but they're under quarantine right now and are being monitored by the county. And lastly then, moving to very locally here at Kaweah Delta, one of the questions again often asked, so how many tests has Kaweah Delta performed? Well, we've done 26,767 tests, so we're part of that county's 120,000. So you see we're about a quarter of it. So the county's doing a lot of testing themselves. Commercial labs doing a lot of testing as well. So it's really the three of us that are doing that testing for the county. Of those roughly 27,000 that have been tested, 3,619 have tested positive. So our cumulative positivity rate here at Kaweah Delta is 13.5%. So actually higher than the county, higher than the state, and again, because we are almost exclusively testing symptomatic patients. So it should not come as a surprise that actually Kaweah Delta as a testing site would have the highest positivity rate between the county and the state and us. But positively speaking, our 14-day positivity rate is coming down. It's down to 12% as of earlier this week, so another good sign. We currently have right now 38 positive COVID patients that are in the Kaweah Delta Medical Center. This was as of 6:34 this morning. 12 of them are in the ICU, 8 of them are in the intermediate critical care unit, and 18 in a medical surgical unit on 2 South. 10 of those 38 patients right now are on a ventilator, helping them breathe. And with respect to ventilators, again, Kaweah Delta owns 96, and literally half of them are in use right now, and the other half are available. So an even 48 being used, 10 of them by COVID patients, and another 48 that are available. We have 57 employees that are out on COVID leaves of absences. Again, another positive number that we're seeing. That's the lowest number of employees that we've had out on leave because of COVID in some period of time. The majority of our employees have recovered, 280 of the roughly 300 and something that have recovered, and none of our employees are currently hospitalized, so a very good thing. But we do continue to be an incredibly busy hospital, taking care of many more non-COVID patients. As of this morning, the Kaweah Delta Medical Center is running at 90% occupancy. And there is not one single open bed on 4 Tower in the Kaweah wing, 2 North, 3 South, 4 North, 4 South. All the major medical surgical units in the Mineral King wing are literally at 100% occupancy. Now, just to remind you, that is a point in time. Throughout the day today, we will be discharging patients and opening beds up, but at the same time, we're also admitting patients. And so we are staying very busy, even as our COVID numbers drop. And I can't explain why that more non-COVID patients are showing up. But we are taking care of a very high acuity of patients too. And unfortunately, I think many of those are those that, again, were afraid to come to the hospital, fear of contracting COVID, and kind of let their chronic diseases like COPD, congestive heart failure, just exacerbate to the point that they needed to be hospitalized. And by the time they needed to be hospitalized, they were in a much more acute condition. And I would imagine the air quality right now, those patients with asthma and COPD and other chronic respiratory conditions, that unfortunately our air quality is also exacerbating those conditions, and oftentimes does result in a hospitalization. Our open beds right now are very limited, and they pretty much are limited to just those units that we are primarily using as COVID units. There are 4 open beds on 5 Tower, and that's a 24-bed intermediate critical care unit. So 5 open beds there, and we only take non-COVID patients on that unit. We have 2 beds open on the 11-bed Broderick Pavilion, which is also non-COVID only, and that's really a dedicated short-stay surgery unit. And we have 3 beds available in our 21-bed ICU. And they take both COVID and non-COVID patients. And then we have 10 beds available on 2 South, which again is largely a COVID and respiratory care unit. So very busy right now, and that's why you hear us really trying to emphasize to our community to continue to be vigilant, continue to exercise good behaviors of distancing and mask wearing and washing your hands. We don't want to see anybody get hospitalized, and certainly COVID is an avoidable disease or virus. If we do the right things, it's not like a heart attack or a stroke, or if you have COPD, or you're a renal patient. Those are conditions that you live with or that you experience that oftentimes are unavoidable and put you in the hospital. But we can avoid COVID, and so we certainly imploring the county, our community to again exercise so that we can be available to take care of the rest of our community. And we'll always be here, obviously, to take care of those people that do contract COVID. But just let's do everything we can, and certainly with the Labor Day holiday coming up. So Oh, I did. Yeah, actually,
You know what?
Deb, let me share one other thing. Yeah, this kind of off script a little bit here. I'll be quick with this, but I think this is something you'll find interesting. Sandy Volchko, who's our director of patient quality and safety, she gave a report to our board the other day, looking at a pretty big segment of the COVID population. So not all of them yet, but all of them that have been that their care has been completed, and unfortunately they either passed away or they were discharged, and just what was going on with them. So I thought you might find this interesting. The average length of time that a COVID patient is staying in the acute medical center, we have seen that steadily declining over the last 3 months. So back in May, it was consistently running at 11 days or slightly higher. And in July, we saw that drop to about 8.5 days. So we actually are learning more and more how to successfully take care of COVID and different treatments and protocols. Dr. Malley, who heads up our critical care intensivist program, he and I did a television interview yesterday, and he was talking about how important it is that people get to the hospital as soon as possible, that you don't wait till your condition has got so severe that you have no choice but to go to the hospital. But if you get to the point, I really need to, be in the hospital and get the care there, we're finding that we're being much, much more successful in having a really positive outcome and being able to treat a patient in maybe just 3, 4, 5 days. So really encouraging you to seek care earlier than later. The two most prevalent underlying comorbidities where people that contract the virus that end up in the hospital are diabetes and hypertension, high blood pressure. Far and away, those are the underlying conditions that most of our COVID positive patients have. So again, just those folks out there that have those chronic conditions just have to be extra careful because they are more susceptible to having a more severe reaction to the virus. The severity of the cases, the proportion of those patients that have to be ventilated has steadily been declining. So almost 15% in May, down to 12% in June, and just slightly more than 10% in July. So again, I think that might be reflective of getting to the hospital earlier. Remdesivir, the antiviral medication, appears to be more effective when administered in the early stages of the virus, as opposed to at the time you're finally on a ventilator. Mortality also declining. Back in April, 34% of our COVID hospital admissions were passing away from the disease, and in July we saw that number dip below 15%. Readmission rates of COVID patients also, we were back at 11% in April and down to 4% in July. So that's just kind of a snapshot of the clinical things that we're seeing in COVID patients, and certainly drawing attention to diabetes and hypertension, and really being ever so vigilant with that population. Okay, so that's my long lead-in, Deb.
Thank you, Gary. If I was in the room with you guys today, I know the guys, we would be looking at each other smiling, because that's the first positive report really like that in several weeks, where we're starting to see the numbers decline.
Right.
And I really want to give the community the thumbs up for, as we get out more and we are socializing, we're wearing masks, and we're trying to be just more aware of our surroundings. But Diane emailed me while you were talking about the leave of absences, Gary, because 57 was our lowest number that we've had on leave of absence, I believe, in several months. And so she just emailed me and she said, now we're down to 50.
Oh, so wow, great.
That's hot off the press today. So yeah, good news all around. So thank you for that. So last week, I believe it was last week, Gary, you had some numbers. People want to know how this pandemic compares to the flu. So a question that came in this week is the percentage of COVID patients on ventilators about the same or higher than the percentage of people who end up on ventilators from the flu? And if so, what is the approximate percentage comparisons there?
Yeah, and we don't really have an answer on that because the flu varies so greatly from year to year. Just a couple years ago, I think it was the 2017-2018 flu season was one of the most severest we had experienced over, say, a 10-year period. The flu definitely hit really, really hard, not just in Tulare County, but statewide and nationwide. We had many more hospitalized flu patients. I remember talking to Dr. Malley personally about the number of patients flu patients that he was taking care of on the ICU and how young they were. Patients in their 30s that were being intubated. But then the last 2 years have been much lighter flus, and it depends a lot on the effectiveness of the vaccine, which can vary widely in terms of its effectiveness, although I always encourage people to get vaccinated. It doesn't guarantee that you won't get the flu, but we generally find that if you do still get the flu, that your symptoms are more mild and you recover more quickly. So we don't really track that information about how many flu patients were on a ventilator in any given year. But I would say even if we did, to say how does the COVID experience compare to the flu, because the flu is different almost every single year. So I'm sorry I don't have a definitive answer there.
Okay. So do you think your decreased positive results could be due to no longer using the more accurate PCR test?
Yeah, it's a great question. People ask me, how are we going to get the positivity rate down? And this kind of related to the testing. There's two ways really to do it. One is that fewer people contract the virus, and maybe that's because we do such a phenomenal job of social distancing and mask wearing and washing our hands and not touching our faces and everything, that we just see fewer people contracting the virus. So that's one way your positivity rate goes down. But the other is you just start testing many more people, and you start testing both symptomatic patients and asymptomatic. Although that term asymptomatic, that means you have the virus, but you're just not exhibiting symptoms. So actually expanding the testing to just everybody, whether you have the virus or not, and certainly then the denominator gets huge and your positivity rate falls. So we'd like to actually do both. We'd like to see the positivity rate, or the number of actual cases decline, and we'd like to do far more testing. Now, we do have two molecular testing platforms. That's the BD Max and the Abbott ID Now. The BD Max is the only PCR lab analyzer. The Abbott is not PCR, but they both are molecular, which means they have a higher sensitivity rate, and they actually are designed, both those analyzers are designed to actually detect the DNA of the virus. And the BD Max, which is the PCR molecular test, is the most sensitive. In fact, what's a bit frustrating is it will continue to detect the virus long after it's died and it's no longer contagious, but there's dead virus cells still in your bloodstream, and it's constantly retesting and retesting, and is so sensitive it picks those up. But the Abbott ID Now is also very sensitive. There's no doubt about it that we've been really squeezed over these last few weeks with the lack of testing kits, the availability of them. We still have them without a doubt, but we're finding that our inventory levels are really starting to fall, as BD Max has had major issues with the manufacturing of its reagents, its test kits. And then Abbott ID Now, They're trying to expand their capacity. They actually built a new plant or expanded their plant, but unfortunately their first lot that they ran didn't pass quality control, and so it kind of shut them back down. And so those additional kits that we were expecting to receive haven't been received. But right now, we're still just doing our testing on those two platforms. Again, the BD Max and the Abbott ID Now. So, and we haven't really reduced the amount of testing that we're doing. I wouldn't. The short answer to the question is I don't think that is why the positivity rate and the number of positive cases has been falling, because we are continuing to do PCR tests. Although, as you point out, the BD Max is the only PCR test. Both are molecular, but this is a PCR test, the most sensitive, and we are kind of curtailing our use of it. We're using the Abbott ID Now much more frequently, and it is slightly less sensitive, but I don't think it would really result in a material drop in identifying cases or that positivity rate. We are, as I've talked about, we have now secured a third testing platform called the Kaweah Sophia 2 platform. That is not a molecular platform, that is an antigen based platform. So the antigen is the protein that is on the surface of the virus cell. And so the Kaweah platform, using fluorescent light and ultraviolet light, it detects the presence of that protein on the virus cell. We just acquired 15 analyzers, and we have now, I think, 15,000 test kits. And we have placed orders all the way up to 75,000 test kits. We are in the process of training our staff right now. The testing will take place in our laboratory, but we will deploy these analyzers out to all of our clinics. We'll put one out at Visalia Medical Clinic, our urgent care centers. So we will have the ability to literally test just about anyone. And we will begin testing those that have symptoms and those that don't. Because we definitely want to be able to greatly expand the testing that we're able to do throughout the county to allow us to do contact tracing and really get a handle on this virus. So we're really excited about that. We should be rolling that out maybe in the next couple weeks. What I think everybody will enjoy too is that it's only swabbing inside of your nostril, not going all the way up into the sinus cavity, which is a very uncomfortable swab.
Yeah.
So,
I was going to
yeah.
ask that question when you said molecular versus antigen, because I just had the test, before I went into surgery, and it is not a fun test.
No, it is not. No, it is not.
It's really uncomfortable, and I thought I was going to die there for a minute.
Yeah, I know. I love when they say this is going to be a bit uncomfortable. No, that is an understatement. It is more than uncomfortable. So I think we're all looking forward. Yeah, and we actually we will continue to use the BD Max and the Abbott ID Now really inside of the hospital. That will continue in testing employees and physicians and patients that are presenting to the hospital. We'll continue to use those molecular platforms because they're just more sensitive and I don't want to say more reliable, but there isn't the same reliability, accuracy, sensitivity on the Kaweah, although it's very, very high. But it can produce some false negatives as well as produce some false positives. But we also are exploring right now a new PCR molecular analyzer that may be made available to us, and it looks like the supplies of the reagents and the testing kit for this high production 500 tests a day that most likely will still be nasal pharyngeal, the deep swab, but using the PCR molecular, but having an abundant access to supplies and everything. Again, we would most likely, if we do acquire this, it would replace the BD Max, but we would continue to use the Abbott ID Now for the more instant turnaround on results. But if all of these things fall into line, we really will have incredibly expanded testing capability for really the entire county. And we're working closely with the Tulare County Health Department on that strategy of being able to roll this out and much more broadly test the community. So we're really excited about that.
Okay. So you mentioned, I believe, in your opening when you were talking about the numbers, you mentioned the total number of COVID tests that Kaweah Delta has performed.
Right.
So why is that number not reported on the daily snapshot?
Yeah, I get asked that occasionally. I mean, I think it was really relevant in the early stages of the pandemic, largely because Kaweah Delta was pretty much the only specimen collection site in the entire county. And next to the county, Kaweah Delta was the only hospital, only other site that was actually doing testing. But now, with the county having now performed, or county-wide, and it's Kaweah Delta, the county lab that's located in Tulare, the testing that Sierra View Hospital is able to do, and also the commercial labs. That collectively, we've performed 120,000 tests of Tulare County residents. And so is it really meaningful to know that Kaweah Delta did 27,000 of those tests? So I don't know that specifically knowing how many tests Kaweah Delta is doing as compared to everybody else, if that's as meaningful anymore. So that we've kind of chosen to focus more on the things that the community is really asking us for, like the positivity rate, the number of hospitalizations, number of patients in critical care, number of patients that are on vents, number that are recovering, and we actually, I think today is where we are publishing for the first time our new COVID snapshot or dashboard. So we've been working on it over the last several weeks, really, again, listening to the community, the feedback, the things that you're really interested in seeing on a more real-time basis. And so we've developed about 8 or 10 different graphical displays that give you the real time as well as what's over the duration of the pandemic. But we hope you'll find those to be really valuable, interesting, insightful. But we also welcome your constant feedback. And so if the testing at Kaweah Delta, if that's something that the community really wants to see, we certainly we want to be responsive and we want to be your source of information. So that's something that we could add.
Okay. So here's a question. Why are the hospitalizations dropping so much while the number of positive cases is consistently increasing? Is it possibly because those who are spreading the infection are younger?
Well, it could be that those that are contracting the virus are younger. In fact, that is what we are seeing. That's a pretty big age category. I gave the 18 to, 49. But we are finding more and more over the last weeks and couple months is that a disproportionate percentage of those that are contracting the virus are younger. And I've said they tend to be the more social. They're probably I wouldn't say more frustrated or restless. I mean, you've seen what's going on at our colleges. Almost as soon as they reopen, they have to shut down because college kids getting together and having parties. And so that is kind of what we've been seeing. More and more young people are contracting it. But because they're younger, because they tend to have fewer underlying chronic conditions. A lot of times you don't develop hypertension or diabetes or COPD, congestive heart failure, until later in life. They have they do a better job of being able to successfully overcome the virus without having to be hospitalized. They're able to to treat themselves, quarantine at home, and fully recover without ever having to come to the hospital. So, but that's not it's a good thing that they don't have to be hospitalized. But they're agents for carrying the. There's a lot of articles being written now that young children may actually be the super spreaders. That they tend to have a higher viral load that they're carrying, which makes them super contagious. But because they're young, their symptoms are mild or they're entirely asymptomatic. So the last thing we want to see happen is young people contract the virus, successfully battle it at home, but they spread the virus to older people or people that do have the underlying complications, who then do end up in the hospital. So to me, that is what we're seeing. Younger people contracting the virus, more positive cases, but very few of them actually having to be hospitalized. Not that they don't get hospitalized, and that's also been kind of a message that we're trying to get out to young people is we do end up seeing younger people being hospitalized, but oftentimes they do have diabetes or hypertension even at a young age.
Okay. On the other hand, too, Gary, the question is, why aren't we seeing spreads in our daycares and our all of these organizations that now have permission to bring in large groups of kids, and we're not seeing spreads in daycares and preschools?
Yeah, Kaweah Delta, we just turned our lifestyle center into a day camp of sorts. So that it can't operate as a gym right now under the governor's orders, and that very unfortunate. They were open and closed in such a short period of time, and but we have so many working parents. So many of our nurses and our doctors, have young children, and they were really depending on schools to reopen in the fall, so that the children could be physically at school while they're at work, and only having to arrange for daycare, after their children got out of school before they got home from work. But then the schools were not able to reopen, and so it potentially was going to really impact our workforce. So we looked into, would we be able to open the Lifestyle Center as a place where parents could bring their kids. We exercise. We're using all the spaces in the Lifestyle Center, which, if you've ever been there, there's a basketball gym, and there's lots of different places where we can have children, and we only have 40 children at any one time in the Lifestyle Center, and that's governed by state regulation. But so we have the ability to keep children very distant. They all wear masks. They practice good hand hygiene. We screen them every day for temperature and other symptoms. And so far, we've been open for just a couple weeks, and we have had 0 COVID cases. I know that I sit on the board of the Boys and Girls Club, and we had a meeting last night, and the Boys and Girls Club over what we call the Gindick Club over on Tulare Street, they've opened up as a day camp as well, where they're open like 7 in the morning till 6 at night. Just like the Lifestyle Center, we have adult teachers there, and we're essentially there to help kids, help them through their virtual school day. So they're on Zoom attending school, but they're able to be, around other students safely, but also have the support of a teacher that can help. So the Boys and Girls Club has done something similar, where again they're exercising, all the precautions that they need to. I think they said they had 28 kids that were participating in this day camp program. Pro Youth Heart is getting ready to, if they haven't already, I think 1st of September, establish those. So I think the reason we haven't seen it in daycares and day camps is they're being, again, very vigilant in how they have set themselves up and everything that they're practicing. So I continue to hold good thoughts for them, and that they're able to continue to provide that critically needed service to our parents and our community.
Yeah, we joked about it in our employee huddle a few weeks ago when we announced that Lifestyles would be opening as a day camp. And we said, we will have the most in-shape kids at our distance learning site because, just throw them on a treadmill.
Yeah, I'm jealous. I wonder if I can find a way to go back to school.
Yeah.
Yeah.
Okay, so, before our community was shut down, the governor had issued like a percentage, a positivity percentage that we needed to stay below. So will we ever get off his watch list? And has he released any kind of metric or baseline that says once you get below this percentage, then we will be able to reopen?
Yeah, I don't think he's released any new or changed metrics since he first rolled out his 4-phase reopening plan. But the threshold has been, with respect to a positivity rate, is to be below 8% for at least 14 consecutive days. I think I reported that the county, and this is measured at the county level, so it's not city specific to my knowledge. So for Tulare County, throughout the entire county, to be able to open back up and go back to what was phase 3, which allowed barbershops, salons, gymnasiums, in-room dining, all of that was allowed in phase 3. And so the 7-day positivity rate for Tulare County right now is 12.6, so too high, above that 8%. The 14-day is 14.3, too high, obviously above the 8%. So the way we get it down is Kaweah Delta, you get that Quidel testing ability deployed throughout the county, and we significantly increase the amount of testing we do, and we don't limit it to just symptomatic people. And at the same time, we as community members, we continue to be very vigilant in doing all the things that we should do, protecting one another from getting the virus. And I think in combination of those two, we can get below the 8% and pretty quickly. The Quidel test has results back in 15 minutes. So it's not sending it off to a commercial lab. And although I have to say, the tests we're sending to the commercial labs, we're seeing about a 48-hour turnaround now. So that's very, very good to see that. But again, with the Quidel, to be able to in an unlimited fashion do testing, get results back immediately. We report those results quickly to the county, who then reports them to the state. So I think if we do those two well, that we can get to that 8% in pretty short time.
Okay, so last week during the meeting with Carrie and John, we referred to the bubble. And one of our community engagement members asked, what are you guys talking about when you're talking about the bubble? And we used it in reference to us not wearing a masks with each other in the room, like you and I sit next to each other. So can you talk about the bubble and why we refer to the bubble?
Yeah, so as I understand it, that's a new term. We're going to develop a whole new vocabulary from this pandemic, but I guess they call it a social bubble. And so I would say I probably have my own social bubble. That is me, my wife, and my 2 children and their spouses. So when we went to Summerlin, we were all together. We shared a house. We didn't wear masks around one another. We didn't practice social distancing around one another. But whenever we left the house, we put our masks on and we socially distanced ourselves from strangers. So we would constitute a social bubble. And you feel safer in your social bubble when you know that the people that are in there with you are also exercising good behaviors. They're washing their hands continuously. When they're not in the social bubble, my son goes back to Camarillo with his fiance, my daughter goes back to Long Beach, but when they're there, I feel confident that they continue to exercise good behaviors, and they don't, they might have another social bubble of just their friends, but again, if those friends in their social bubble are doing everything that they should be doing, then my social bubble should be safe too when they come into it. The smaller your social bubble, probably the better. But in essence, it's a group of people that you feel really safe with, and you feel confident that they're exercising all the same behaviors that you do. So if I know there are people, I have some friends every Friday night, they gather for wine on the patio of one of their homes, and they're all good friends. I've attended one time, and they space everything out, but they don't wear their masks around one another. But it's fun to watch them, because if somebody comes up to get something to eat, the rest back away. So they do exercise some distancing, but they feel safe in that particular social bubble, and they kind of hold each other accountable. There's an expectation. You want to be in our bubble. I got to feel really confident that you're going to do the right thing. So there probably has to be like an application process to get into that bubble. But
Yeah, it's very hard for people like me I'm very social. My social bubble's very big. But
I don't know, Deb.
I know
Yeah.
I do my best to take care of myself, wear my mask, be aware of things, but you have no idea who you're walking by at Lowe's, Gary, right?
Yeah.
I would much rather be with people that I'm comfortable with than, you have no idea.
Nope, you're
So-
right. You're right. I just don't want your social bubble to be 50 people because you just, obviously, the larger the bubble, the greater the risk, because, those people will interact with people who interact with people. There's the exponential. Your bubble, there might be 50 people, but it's exponentially larger through all their contacts, and so you just have to be careful.
Okay.
Okay.
All right. Gary, are we offering flu shots at the urgent care yet?
Not yet. We kind of mark October 1st as being the start of the flu season. That is generally when we start vaccinating all of our employees. We generally will start October 1, and we want to be completely done by November 1st. So that's when we'll start making probably flu vaccines available in our clinics and urgent care centers. Will be around between that October and November timeframe.
Okay, perfect. So Gary, I think you covered all of the other questions. People wanted to know how many patients we've discharged, how many COVID patients. Did you cover how many COVID patients we have discharged?
We probably discharged about 800 at this point. I know just 2 weeks ago, I reported that we had treated 720 inpatients, and we had approximately 112 deaths over those 720 patients. So I didn't see maybe I have the numbers in front of me here. Oh, yeah. 771 patients now. 125 of them have died. We've discharged 599 people. But one of my exec team members wanted me to share something with you that I don't think we've ever shared before. We've actually treated another 3,000 COVID outpatients. So patients that have come to our clinics, come to the emergency department or urgent care centers that we did positively confirm for COVID, but their symptoms weren't severe enough that they needed to be hospitalized. So they essentially were treated in whatever appropriate manner in an outpatient site, and then discharged home to quarantine and recover at home, but it ended up never having to be hospitalized. So 771 inpatients in the hospital and approximately 3,000 treated as COVID outpatients.
Okay, well, Gary, thank you. I think we have answered everybody's questions, and I'm watching my phone and the chat, so I think we are done. So would you like to close this meeting with a farewell?
Yeah, thank you, Deb, and thanks again. I see we have only 30 people on the telecast today, and a lot of very familiar names. Thanks for hanging in with us over this 25 years or 25. Yeah, it probably feels like 25 years, but yeah, our 25th weekly broadcast, and it has been very rewarding. I mean, I'll even call it's been fun. You've given me a great opportunity to grow professionally and personally through this. I can't ever imagine myself that I'd be doing this someday, but I really appreciate the opportunity. I appreciate all of you, tuning in every week. I appreciate your great questions. Very sophisticated, sometimes very complicated questions, but thank you for asking them. Well, Deb's right. We do put a lot of time in preparing for them. It makes us better. It actually makes us more informed and more fluent in talking to other folks about it. So thanks for all your support, and I know you're the ambassadors of the organization. I hope you're out there spreading the word of encouragement and asking people to be safe to one another and to take good care of themselves. And we'll see each other before the Labor Day holiday, but no reason we can't start reinforcing those behaviors and role modeling what we'd really like to see out there among our community. So thanks for being here. Hope you have the rest of the great day and have a great weekend. Thank you.
Thank you, everybody.